The Honourable Cameron Murphy.
I rise tonight to speak about the pressing issue of access to abortion services in regional and remote New South Wales. Abortion is legal in our state, yet there are still significant barriers faced by those seeking terminations. Media has recently reported on two major hospitals in regional New South Wales, Orange Hospital and Queanbeyan District Hospital, that were not providing termination services. Documents obtained by the ABC revealed that staff at Orange Hospital were banned from doing so. The ban was enforced by hospital management on all abortions performed for, quote, non-medical reasons. This was not a resourcing or staffing issue, but an explicit ban issued by management on health services that had previously been performed at this public hospital without issue. Thankfully, Health Minister Ryan Park intervened immediately to ensure that abortion services at Orange Hospital will be restored. His quick action is to be commended. The fact that this ban was ever in place, however, highlights a serious continuing issue in the provision of healthcare in regional New South Wales. People in remote and regional areas face barriers to accessing healthcare generally, including the tyranny of distance, cost, and a lack of medical practitioners in these areas. There is a more pernicious and insidious issue, however, which primarily impacts abortions. This is the practice of conscientious objection by medical professionals, in which practitioners can refuse to perform certain medical procedures on moral or religious grounds, must refer the patient to somebody who will. In practice, this has a devastating effect for aspects of women's access to reproductive medical care. As medical abortions can be provided by a GP, there are a number of links in the chain where care can fail: in the doctor's office, at the chemist filling a script, or at the hospital. In many country towns, there's only one doctor, one hospital, one pharmacy. A referral to another medical practitioner who is many hours' drive away is not a meaningful referral. This is particularly the case for women who are young, on low incomes, or in a domestic violence relationship. They have no realistic way to take up the referral and to get access to the healthcare they need in a timely manner. Unfortunately, this allows conscientious objections to be used as a tool to stop people getting abortions. Experts have described the current availability of abortion services in New South Wales as a, quote, postcode lottery, or a, quote, unspoken ban, citing cases where women have been forced to continue unwanted pregnancies due to a lack of access to care. As a barrister, I'm very troubled by the notion that any professional can refuse to perform their job because of their personal views. At the bar, we have what is known as the, quote, cab rank rule, which prevents a barrister from refusing a brief if they have the time and they're paid appropriately. I would not be able to refuse a client simply because I did not agree with their alleged crime or their previous conduct. Why is a doctor allowed to refuse medical care to a woman just because he disagrees with her choice?
Order.
Some might find it difficult to set aside their convictions in order to provide a robust defence for those accused of serious crimes. Those people choose not to be criminal barristers. Similarly, medical professionals who find themselves unable to deliver medical care because of their religious views should consider if they're in the right profession. The requirements of registration for doctors and pharmacists should be reviewed in order to ensure that medical professionals are prepared to provide care within their skills, regardless of their personal views. Healthcare is a human right. It should be available regardless of where you live, for free, when you need it. Professionals committed to the health of others should never stand in the way of that because of their personal convictions. If they feel they can't provide some services, they can and they should choose a different profession.